Well, thank you so much for having me here today. I want to start just by thanking Discovery Park for funding this project, and also Health and Human Sciences has contributed some funding to help us get started, as well as PIN. I also want to acknowledge I'm part of a very large team. I'll show you their faces, but I wanted to specifically acknowledge Mandy Rispoli, who's in College of Education, and Ann Serino, who is in Health and Human Sciences and Biomedical Engineering, who are helping me co-lead this project. So, all right. So I'm going to begin today in the community with a phrase many of you have probably heard if you've worked with somebody with autism, known somebody with autism, or loved somebody with autism. And that is, if you know one person with autism, you know one person with autism.
If you know a person with autism,
you know a person with autism.
This phrase is commonly shared by parents, self-advocates, friends, researchers, and community partners. We know that autism is a diverse spectrum, and each individual affected by autism represents a unique set of strengths and needs. Yet the current science that guides autism diagnosis and treatment tends to overlook the individual. Our fields have worked in silos and have largely ignored the intersecting, multifaceted factors that make each person with autism unique. Purdue University and Discovery Park are ideally positioned to radically shift this narrative. Our big idea is to establish Purdue as the world leader in personalized health for autism. Our team of experts have a strong track record of conducting high-impact, externally funded, and interdisciplinary research, with expertise ranging from cell cultures to community cultures. With support from Discovery Park, we will have the leadership, scientific ecosystem, community support, and infrastructure necessary to address our big idea head-on. Now is the time for Purdue University to emerge as a global leader in precision health for autism. Because as the saying goes,
did you know friend with autism? Did you know friend with autism?
Thank you to HHS for helping us make that video. So, if you've met one child with autism, you've met one child with autism. What does this mean? Well, many of us know that autism is a really diverse spectrum. So while many individuals with autism work and live in our community, work right here at Purdue, others have substantial needs that really impact their quality of life. So for example, out of every 10 individuals with autism, about a third won't develop the ability to speak, about half will have intellectual disability, and about a third are at risk for elopement or wandering, which is actually the leading cause of death among individuals with autism. So this diverse spectrum has really puzzled researchers for decades, and we've invested millions of dollars into understanding why autism emerges. Why is the spectrum so diverse? Why are people with autism so unique? And we still don't know the cause. We still don't know what actually causes autism, and how can we leverage information about cause to have a targeted treatment. And I think part of the reason for this is that we've really investigated the causes of autism in scientific silos. So geneticists have looked for their genetic causes, environmentalists have looked for their environmental causes, developmentalists have looked at longitudinal trajectories, and a very small portion of autism research has considered sociocultural and demographic factors. Everybody is doing their work in isolation. So our big idea is to bring these fields together right here at Purdue and really brand Purdue as a world leader in personalized health for autism through the development of what we're calling Pocket. So Pocket is the Purdue omnityping kit for individualized treatment. And our idea is to bring all of the leaders at Purdue together who are studying autism in diverse ways and come up with a home-based assay system that we can mail to families and actually look at how these different risk factors for autism intersect within individuals. So this idea of personalized health and mailing kits to families isn't new here at Purdue. In my own research, and this is just one of the many projects here that has given way to this proposal, but I have NIH funding to develop what we call PandaBox. So this is parent-assisted neurodevelopmental assessment, where we're mailing testing kits to families' homes to look at the clinical and psychophysiological risk factors that we know predict autism in infancy. So we've been doing this for a number of years. We're already engaging families across the country in telehealth-based and remote assays to look at autism risk in children. What's new about PandaBox or Pocket is we're really leveraging our whole Purdue community to bring this to more of a biological, complex level. And our team, as I mentioned, is very large. So we have experts in basic science, imaging, neuroscience, biomedical engineering, public health, psychology, speech and language, education, human development, communication and the liberal arts, and then also big data and healthcare engineering. And we've seen some of these fantastic scientists already present today. We represent 8 Purdue colleges, we span 5 Discovery Park institutes, and we already have over 35 relevant extramural grants that are paving the way for this work to happen. So we have 4 key initiatives now that are underway to develop Pocket at Purdue. Our first, and I won't spend much time on this today, is to really build and mobilize this ecosystem that can sustain this science and this dialogue for decades to come. I wanted to briefly mention that we do already have a conference planned for this spring. Mandy and Brandon Keene in Speech and Hearing Sciences are leading this initiative, and we hope all of you will attend. But our second initiative, and this is what we're really focusing on this year, is actually optimizing Pocket for data collection. And we're going to do this in a number of ways, ranging from surveys on the sociocultural and trends that might affect the uptake of Pocket. We've got excellent scientists that are actually working at the biological level to develop novel assays that we could literally put in this box. We have folks like Brandon Keene and Becca McNally from IU School of Medicine who have a great project already underway where they're developing better ways of actually describing autism symptoms clinically based on biomarkers so that once we have this great assay, we can link it to the actual phenotype. And then we have a number of folks interested in really tailoring Pocket to a diverse user base because we know that in the field of autism, there are huge and persistent health disparities in terms of access to both research as well as diagnosis and treatment. So we want to make sure that from the onset, we're really thinking about our entire community when we're developing Pocket. For example, Carolyn McCormick and Andrea De Maria are developing a pilot project right now that's about to launch, looking at the sociocultural, demographic, political factors that might affect the uptake of Pocket in diverse communities. This is just one of many projects that's underway. Once we've developed Pocket, we're going to examine how it works in our community. So in the second year of the project, we're shipping out our kits, our Pocket kits, along with PandaBox, which is our clinical assay, and the taxonomy, the clinical work that Brandon and Becca have been developing this year. And we're going to engage 3 different participant cohorts to really bring Pocket to the community. So the first is a genetic risk cohort. These are children with rare neurogenetic disorders. I have a cohort of about 150 families we've been studying in my lab at Purdue. We also have an environmental risk cohort. These are children from the East Chicago community who have been exposed to high levels of arsenic and lead. And we know that those risk factors are known to be associated with higher risk for autism. And so we want to make sure that what we're developing is amenable to those populations. That community is also incredibly underserved. So again, this fits into our commitment to making sure that what we're developing is accessible to everybody. And then finally, we have a clinical risk cohort. This is through partnership with IU School of Medicine, where they have a great EE Hub program where families can bring their children when they're concerned. And so we're going to work with those families who are seeing behavioral signs of autism and want to know kind of what are the next steps for their family. And then finally, we're going to work even in the short 2-year period to really set the foundation for treatment. So we're not developing a drug in 2 years. We're not curing anything in 2 years, but we're setting a foundation for really understanding how to improve quality of life for children and families in a number of ways. So one, and I'm so glad Aaron shared his wonderful work with you all earlier, Aaron's involved in our team as well, and with a larger team of investigators is going to look at how we can use iPSCs to really study the mechanisms that might be giving rise to autism and those complex intersections that have been really neglected in the literature. So in high-risk patients with genetic disorders, how do environmental exposures change how their cells are developing and progressing? Going from cell cultures to community cultures, we're also working in a very applied sense with our leaders in the College of Education to deliver telehealth-based treatments to a subset of participants in our cohorts to try to immediately start to understand how can we take this technology that we're developing and these kits that we're deploying and really improve lives in an acute way. So we have experts who know how to help families support children who have challenging problem behaviors, and we're building that into our ecosystem from the very beginning. So I hope you can see that we have an excellent team ready and excited to do this work. We also welcome inquiries from other folks that want to get involved. We're very collaborative. And we're very thankful. So we're excited to partner with Discovery Park on this initiative to really take Pocket into the communities and look at how we can look at these complex intersections across genetics, across environmental exposures, across daily living experiences, and understand better what are the causes of autism and what are those points where we could actually intervene to really support quality of life, both through behavioral treatments and really empowering families, as well as through future drug discovery. And importantly, this funding is really letting us build an ecosystem that can sustain this idea and really build this work for decades to come. So now is the time for Purdue to really emerge as a global leader in personalized health for autism, because if you know one person with autism, you know one person with autism. Thank you.
Thank you so much, Bridgette.
Yeah, sure.
And we have a little bit of time for some questions for Bridgette. Fascinating topic.
Yes.
So it's a fascinating program, and I commend you and all those that are involved. It's a very important topic. And also being a father of a child with developmental disabilities, my question is, what are the opportunities for expanding this to other types of developmental disabilities?
Yeah.
I mean, the community we participate in includes children with autism, but other types of developmental disabilities.
Yes.
And it seems there's a lot of crossover in traits.
Absolutely.
And so that's my question.
Yeah, that's a great one. So obviously we've anchored this proposal to autism, but actually most of my research focuses on children with rare neurodevelopmental disorders that are comorbid with autism, but not definitively autism. And we're very interested in expanding this beyond autism. So even into we've started to coin this term neurodelta disorders, because many of us here at Purdue are studying developmental disorders either in the early developmental period or in the late developmental period, like Parkinson's, where we can start to think about how all of our methods can really work together to improve not just our initial population, but others. So rest assured, there's a lot of great work going on at Purdue related to disorders other than autism that affect kids, and that's an intent, is to really make sure that this work can be applicable and help the most people possible.
Okay, thanks.
Yeah.
Heidi?
Yeah, so in our piloting, right now we're working with the preschool period, kind of late toddlerhood, early preschool period. And we're still obviously really early in developing this, but the hope is that Pocket could really help with diagnostic decision making around the time when autism is usually being considered, which is in that time period. Over time, if we better understand risk factors for atypical development, of course we want to intervene and support families as early as possible. So, with time, I could see trying to extend to earlier ages. But I think this question of intersection and risk and how these different factors work together is not specific, again, to autism, and really expands across the lifespan. So I think what we're trying to do here is really engage a dialogue across stakeholders across Purdue that have expertise that really this could apply in a number of ways. Yeah. Great question.
Any more questions for Bridgette? Bridgette, thank you so much.
Yeah, thank you.